Welcome to this episode of the Cold Start Corner, brought to you by Akrinos. I'm your host, Erich Mattei, joined today by an amazing guest, y'all. So, Dr. Caitlin Reghetti is a name that many of us across the industry have come to know. She works very closely with Akrinos as our clinical liaison, but Dr. Reghetti is blazing trails under the banner of Dr. Reghetti Designs, providing the industry's only doctor-written healthcare literacy assets for the modern practice. And we've got an amazing show lined up. We're gonna explore the whole world of healthcare literacy and differentiation for your cold start. So, Dr. Reghetti, welcome to this episode of the Cold Start Corner. Thank you so much for hanging out with us.
Thanks for having me.
So I know we got a lot of things to get into here, and I think perhaps to kick off the conversation, Dr. Reghetti, I would love for you to share with our viewers just a little bit about your background, right? As a doctor on this journey, discovering this huge unmet need in the market and the impact that you're coming to have.
Sure. So I am an Ohio-based optometrist, born and raised in Ohio, graduated from Ohio State in 2013. After graduation, I went into a private practice for about a year. And then after that, I kind of started branching out to different settings. So I worked in a couple different private practices. I worked in hospital settings, ophthalmology offices, different commercial settings. So I kind of experienced the whole gauntlet of different office settings for optometry, and I really settled into the private practice niche for sure is where I was happiest. But I did find that, being in patient care 5 days a week was not necessarily my favorite thing. So I started to scale back a little bit, especially when I had my daughter. So my daughter is about 3 years old now. And that just really kind of jump-started Dr. Reghetti Designs because it made me want to have more freedom, more flexibility. I wanted to be able to stay home with her some more. I wanted to be able to travel. But it really all started with writing. So my boss that I work with now, he wanted our website to be revamped. So I wrote a lot of the content on our website. I started doing some pamphlets for our website. So I started branching out and basically presenting that to other doctors that, hey, if you have anything on your website you want rewritten, I love to write. And it worked well for a while. I was kind of a freelance writer basically. Then it got to the point of realizing I really like the design side of it. So I love doing the paperwork, the brochures, pamphlets, anything that was patient facing, I love to do. And I really niched down into patient education was my favorite thing.
And why don't you share a little bit about when you had that aha moment? And because I know you've shared with me that it was through being a doctor, communicating with patients, but also looking at some of the research and seeing these huge disconnects across not only optometry and eye care, but really across all of healthcare, this massive communication gap. Why don't you share a little bit about that discovery and when you kind of had that aha moment of, wow, somebody's got to deliver this?
Yeah, I would say that I was definitely noticing while in practice that as I was educating patients, there were just a lot of patients that didn't understand their, common diagnosis. They didn't know what myopia was. They didn't know what the retina was. And some of that is, lack of education, and some of it may be just lack of remembering. But one thing that I noticed in optometry is that we focus a lot on verbal patient education. We don't focus so much on visual education. There's starting to be a lot more focus on the digital side of things, which I think is great, but we don't have a lot of content that is in our offices to be able to hand to patients. So that was kind of the disconnect for me, is realizing all the education that I see in our offices and other medical offices too is just generic brochures that are given from conglomerates, just passed out. And
Sure.
all that information pushes us to a different company or a different website for more information. There was nothing that really linked back to the practice or the doctor that you may be seeing in that office. So that was kind of the aha moment for me, was we need to create this internal feedback loop of educating our patients, sending them to our, digital side, sending them to our website, our social media, and just making it so that they're always returning to us for additional information.
I love it because Dr. Reghetti, you bring up two really critical points that I want to shine a light on. One is that a lot of the content out there, materials that are being kind of pumped out there to providers, does what? It simply pulls the patient to some other, right? It could be some other place to go purchase the therapeutic or the treatment option, or some website to order this directly from a manufacturer, what have you. And as such, point number two is that all of this stuff is really getting in there and it's putting pressure on that doctor-patient relationship, which clearly in this day and age, between the growing public health need for care, and also as it pertains to this conversations, we're not going to jump into talking about the modern cold start and private practice around these themes. In this ever competitive environment, anything that's interfering with that doctor-patient relationship in the private practice can come to also be a threat to the business itself. So really, really fascinating, really fascinating stuff. So, Dr. Reghetti, why don't we now just kind of jump into it and start kind of share? I know you've got so many amazing insights to share in this session. And by the way, y'all, for those that are just tuning in, hanging out here at the Cold Start Corner with Dr. Caitlin Reghetti, we're talking all about healthcare literacy and differentiation for the modern cold start. So, Dr. Reghetti, why don't you just expand on this whole concept of healthcare literacy, right? What do we mean by that? What does that refer to?
Yeah, so healthcare literacy is something I kind of stumbled across when I was looking for different stats about how we are implementing healthcare literacy. So it's basically the patient's ability to understand and access educational material, their ability to kind of digest it, and be able to use that to make healthcare decisions, whether it's when they're going to return for their follow-up, whether they're going to take their medication, whatever the case may be. It's really just it kind of ranks patients of where their literacy abilities are. Are they at a base level? Are they at a professional level? And most of the patients are base level or below. So that tells us that a lot of patients need that extra education. So that's where health literacy kind of came from. And I kind of connected that with optometry, of saying, okay, I really want to build up ocular healthcare literacy. Because it is something that's lacking. There's a lot of stats out there about healthcare literacy and the amount of content that patients can absorb, that they really only accept like 40 to 80% of what they hear during an exam, and 50% of that is typically forgotten. So a lot of the information we're telling patients during an exam is not digested properly for them. And a lot of it too, I mean, there's only 30% of us are auditory learners, and I am not an auditory learner. I'm a visual learner. So you can sit there and talk to me all day in the chair, but as soon as I leave, I'm going to have to take notes on my phone and look things up and try and remember what you said, because I'm not an auditory learner.
It's really fascinating. I mean, you touch on so many critical pieces there. I think the first of which is for everyone to realize that even though something is being communicated, or should I say shared, it doesn't mean it's being digested by the recipient, right? And that's really powerful what you just said. Also, the fact that patient may only be hearing 40 to 80%, but then actually only retaining about half of that. So when we start to really dig down into those numbers, we come to realize, wow, there's a lot of gaps, right? And I think what's interesting also is not only are there gaps as it pertains to the health care of the patient, right? When we think about patient compliance with treatment and what have you, but let's maybe also touch a little bit on differentiation, right? Because that's the other piece here, is where is the information coming from and where is that patient being directed? So why don't you share a little bit about the epiphanies you've had along the way regarding, wow, it's not just a matter of like educating patients, but also how can we protect the integrity of the doctor-patient relationship and differentiate the practice? So why don't you share a little bit of that regarding the practice branding of these types of assets as well?
I think that kind of goes back to that internal feedback loop. So just making sure that all of the information the patient is getting is coming directly from us. So if they are told in their exam, yeah, you have, diabetic retinopathy, I'll see you back in 3 months, and we don't tell them anything else or we don't give them any information, they're just going to go to Google and start researching. So the best thing to do is to kind of niche down that information to a place where they're able to access it, and so that they're not having to get lost in the world of Google trying to figure these things out on their own, or worse, not doing any research and not realizing how important some things are and how important the follow-ups really are for them, especially when it comes to ocular diseases, when a lot of them don't have any symptoms until the really advanced stages. It's important for those patients to really understand from the doctor what's happening, why they need to come back. And for me, I think that it's important to do that in written form where we're actually handing them something, where then has a QR code that links to our website for more information, to our social media pages where they can connect with us, so that we're able to post things that are accurate and not having our patients turn to Google.
Yeah, that's really powerful that you said that. I mean, I suppose in my years around industry and business, there's two things I've come to realize that Google, maybe we don't want. And one is healthcare, right? I mean, who really wants their patients going to Google, asking Google, how should I take care of this red eye? How should I treat my dry eye or what have you? And then the second, in my experience in Akrinos, sometimes Google isn't always the best for actual business advice either, right? Like work with professionals in building your business the same way you expect a patient to work with a doctor to ensure their healthcare. Dr. Reghetti, let's now maybe start to drill into the world of the cold start, right? Because you've joined us on various Akrinos shows here over the years. And again, viewers, if you'd like to check any of those, head on over to Akrinos.com. You'll find some great sessions where Dr. Reghetti joined us on Akrinos Access, expanding on the world of healthcare literacy and such. But what I'd really like to do now, Dr. Reghetti, seeing as this is the Cold Start Corner, is let's really put ourselves now in the shoes of that doctor who's cold starting that practice. And, in our years of collaborating here in Akrinos, you as clinical liaison with Akrinos, I know it's been tremendously exciting us working with doctors cold starting coast to coast. And what I think is fascinating about this concept of healthcare literacy and office branding is how impactful it can be in truly differentiating the practice. So why don't we talk a little bit about that? And again, when we talk about that new practice kind of cutting through all of the noise for themselves to have their presence in the market, what are your thoughts on some of these gaps in patient communication and the opportunity for young practices to really become that authority in their community?
I think that it's really just getting back to the basics. So it's really just remembering that people are people and people want to connect with people and learn from people. You can't really push everything off to, your social media to take care of things. You can't focus too. I mean, obviously you're running a business, you got to focus on ROIs and all of that. But at the end of the day, you need to focus on your patients and the fact that they want to connect with you. They like that independent eye care setting. There's definitely climate change when they go to somewhere that is not a private practice. So especially for those cold starts, just to really establish themselves as, I'm here for you, I'm a doctor for you, let's connect more on a personal level. I think that avoiding all of those, all that content that you can get for free for your office. I mean, it's great because it's free, but it also just gives kind of an advertising type vibe to it, where it just seems like you don't really care. You've just kind of popped it into your rack card holder and it's there if the patient wants it, but it's just kind of cold and disconnected. So I think that for those that are starting a cold start practice, it's just really important to establish yourself as, I am the doctor, I am a person, and I want to connect with you, I want to help you, and here's how I'm going to do it.
Absolutely. And it's really exciting now also to see the latest data out there regarding patient preference. And, when we actually look at some of these white papers from some amazing organizations, I mean, there's think tanks, up at Harvard, out at UC Berkeley, think tanks that are really exploring modern healthcare and the role of private practice in healthcare. And, if we look over the last 15 years, there's been this mass consolidation across healthcare. Well, now we're starting to see the data come in. And the data that's coming in is showing, well, not only is our provider burnout rate and cost of care going sky high with all this consolidation and corporatization of healthcare, but also the overall quality of care in these environments comes to be questionable. In fact, some research shows that as many as 60% of patients prefer private practice because they see the superior quality because of that patient-provider relationship and all these things that we're touching on regarding the overall experience and quality of care. So really, really powerful opportunity here for the Cold Start to be able to differentiate themselves not based on price. So come to our practice because you can get a 2-for-1 deal, but truly differentiating themselves based on the value of the professionalism and the care that's being provided. Dr. Reghetti, if you would maybe share, and it doesn't have to necessarily be a Cold Start, but I know as Dr. Reghetti Designs is coming to work with more and more practices across the country, I know you've shared with me some outstanding success stories over these last couple of years. So why don't you share a little bit of what you see with doctors who perhaps are a few years into their journey and have always used the free stuff from the vendors. And then they're like, you know what? It's time for me to invest in my own healthcare literacy for my patients in my practice. Why don't you share some of that feedback you've gotten from some of these amazing doctors that are getting really great results with this branding of their practice?
Yeah, I think that the ones that are having the most success right now are the ones that have really niched down into specialties. So I've been doing a lot of dry eye, a lot of myopia management. So for those docs that have decided, okay, it's time for me to really focus on one thing, that's where they start, is just on their specialty, and then to expand from there for other patient forms and brochures, and kind of, slowly replace those conglomerate ones with something a little bit more authentic. Will happen over time, but I think the biggest thing for them is starting out with those specialties. So let's just focus on getting our referral forms. Let's focus on getting our patient education. Let me get my website ready to go so that we can link a QR code. So that has been the biggest thing, is just really focusing on those special needs that patients can access through that office that maybe they can't get at another practice in the area.
That is so amazing to hear because, well, as you know, Dr. Reghetti, from your work with Akrinos as Akrinos clinical liaison, it's really exciting in that, quite frankly, it's rare that someone is wanting to cold start without a specialty. As a matter of fact, as I'm thinking about it, Caitlin, I think pretty much every cold start Akrinos has ever worked with has been someone who is going to have full scope optometry in their practice, where they are practicing at the full scope of their license and incorporating these niche specialties into the business. But I think also it's important to kind of level up from that. And really, if you think about what is niche, niche is a hyper target, if you think about it, right? So we could also perhaps even put this into a more general context of just what makes your business different, right? And again, not the difference being, oh, you can get the 2-for-1. We have the best prices in town. Y'all, I mean, that's a recipe for failing optometry, right? If we want to just do this all based on price. So it's really powerful when we consider the role of healthcare literacy in differentiating the practice, but differentiating the practice based on the value to patients and value to the community. Really, really outstanding stuff. So great nuggets through and through, Caitlin. I mean, really, to take it from the top, the fact that there is such this massive gap in communication, right? And it's not that doctors and their staff are not sharing this information with patients, but really we need to put in context the facts that patients, consumers are being bombarded from all angles. So these opportunities for optometrists to differentiate their practice, to enhance the value to the patient, to bolster that patient-provider relationship through practice-branded healthcare literacy is absolutely huge. And particularly from the cold start standpoint, we're talking about how are we going to stand out from the crowd in our new practice? There's just so much opportunity here with really owning the brand. So, wow, goodness me, we're already at the 20-minute mark. Great stuff here. I love having you on these shows, Dr. Reghetti, because again, testament to all the amazing things going on in modern optometry and all the opportunities for independents to differentiate and grow their practice. So why don't we go a little bit deeper into this and maybe now get into some of the more kind of functional applications and maybe even answer the question like how to. So, in sharing with our viewers out there, and although this is a cold start corner, super excited to have doctors across the cold start journey, but also we've got a lot of doctors viewing also that perhaps are already in their established businesses. So when we talk about really owning healthcare literacy, owning the brand and the differentiation of the practice, where to start? I mean, what's some of kind of these, what would you say for someone who's soaking all this in and is like, you know what, I think I'd like to do this. Where should they start in this process?
I would start from the patient perspective. What's the first thing the patient is going to experience? So the forms that you're handing them when they show up, or if you're handing them outdated forms that are barely legible because they've been copied so many times, that's really going to give the patient a feel for what this practice prioritizes, how the patient is prioritized, versus if you hand them something that's, branded and it looks like they've put effort into it, it's kind of customized for their appointment that they're coming in for. I think that speaks a lot more that the doctors and the staff truly care about the patients that are coming in. So it's just kind of following the patient experience through your office. What kind of information do you have in the exam room to give them about their health? What type of information do you have over an optical so that they can understand what they're choosing in their glasses and why they're choosing different things? So it's really just prioritizing where your patients are going to be experiencing that, basically like how you're going to, how you're going to connect with them as they move through their experience through the office.
Love it. And it all starts with, and I'm with you. I think you hit the nail on the head. It all starts with put yourself in the shoes of your patient, right?
Right.
Well, I know we do a lot of leadership and team building things with clients and with some of the workshops that Akrinos puts on at Business Builder, by the way, Business Builder Vegas coming up in a few months. But I know one of the things we talk about in the leadership and communication development, we're talking about the DISC behavioral profiling, is there's the golden rule, treat others the way you'd like to be treated, but it's the platinum rule, treating others the way they want to be treated. So an application here, where to start, put yourself in the shoes of your patient and understand what is their experience in digesting information from our practice. And to your point, Dr. Reghetti, if what we're giving them is, something that's been Xerox time and again, and now it's like kind of blurry in a corner and kind of partially legible, time to get out with that, right? Let's really get with the times and give patients things that they can really not only understand, but I think it's also important for everyone to take away. It's not only a matter of is it legible, but also how does it show up, right? We're in the year 2024 when this is being recorded, but we're in the year 2024. If we're still communicating with patients and providing them with materials the same way we did back in 2004, how is that going to go over? What kind of wow factor is that going to give of your practice? How is it truly going to differentiate your business next to anything else down the street, right? Really, really great pearls here, Dr. Reghetti. Why don't you now, but before we go, and I'm looking forward to you sharing a little bit more about the scope of Dr. Reghetti Designs, but before we jump into that, any other best practices you've got? So once again, you said the starting point is take the time to put yourself in the shoes of your patient and then prioritize how we would want to go about enhancing that feedback loop, enhancing that patient literacy through healthcare literacy and practice branding. What are some other best practices you've got to share?
I would say talking to your staff, because the staff are going to be the ones that can really give pointers as far as this is where we could save time. This is what's working. This is what's not working. This is what I have to keep re-explaining to patients, and just using their information to kind of decide where would be the best place to invest your time and your money into patient education. So if they're, re-explaining the same follow-up regimen every time a patient comes up for a dry eye follow-up, then maybe the doctor needs to, invest in some more written material for dry eye. Or if, patient forms are taking way too long, maybe we need to shorten them. Maybe we need to digitalize them, put them on the website so they can just do fillable PDFs, so that the patient doesn't have to sit and wait, and it doesn't throw off the schedule for patients sitting in the waiting room filling out their form. So I think just getting information from the staff is huge, because they're going to be the ones who are going to have the best input as far as what's working and what's not.
Absolutely. Absolutely. And look, this is applicable to an established practice just as much as it is to that brand new cold start. Of course, the opportunity with the cold start is you can start from day one, patient zero, with this amazing experience. And by the way, to our viewers out there, within Akrinos's Practice Launchpad, as a cold start, you actually get a bundle of practice-branded healthcare literacy directly from Dr. Reghetti Designs, all inclusive in your Practice Launchpad with Akrinos. So be sure to head over to akrinos.com to learn a bit more about that. And I suppose that kind of segue into, well, what is kind of nearing the end of our time together here, but not without, first and foremost, Dr. Reghetti, why don't you share a little bit about the scope of Dr. Reghetti Designs, the solutions you provide, impact to the practice, ROI, and also please share some of those testimonials. I know you've had some remarkable testimonials from some doctors out there that are the movers and shakers of the industry that are really making it happen. So why don't you please share a little bit about the scope of work that you do there at Dr. Reghetti Designs?
So I really do everything from patient intake forms, rack cards, brochures, and the website offers a bunch of templates. So if you're not exactly sure where to start or what you need, you can choose a template. The template, when you purchase it, it includes all of the branding. So it's going to be made to color match your office. It's going to have your information in there. If there's a certain regimen that you want swapped out, or maybe it's a dry eye treatment that you want, we don't offer radio frequency, can you remove that? It's all designed to be just a template. So it's customized for what exactly you need. And then we also have the option of doing a fully custom design. So if you're not finding a template you need, if you need something a little bit more unique, we work together of just creating a completely custom form for you. So that is just charged hourly. We work together, we email back and forth, figure out exactly what you need, and we come up with something that is unique for you. So that is not something that will ever be resold as a template. It's something that you own, that you're going to be the only person that has it. So my testimonials, let me see if I can pull them up here. I've worked with a lot of really great people, and the testimonials that they're giving me is just amazing. I'm so thankful for the feedback from them. Let's see if I can pull some up for us.
And while Dr. Reghetti is pulling up some of those, so in the 3 years that Akrinos and Dr. Reghetti Designs have been working closely together, y'all, we have come to helping practices that are really at all stages of the practice life cycle maximize the potential of their business with practice branded healthcare literacy content. And I will tell you time and again, every Akrinos client that has ever done any sort of customized branded assets with Dr. Reghetti Designs, the results absolutely speak for themselves. And I think something also I'd like to toss out there and really invite everyone to digest and consider is, think to yourself, the future of vision care plans in your practice. Do you want them? Do you want more of them? Or do you want to get rid of them and eliminate them from your practice and from that of your patients? Y'all, healthcare literacy, these customizable forms that Dr. Reghetti is speaking of, y'all, this is all the stuff that is on that path. Now, you're not going to find this from the managed care plans. They want to give you everything to keep jamming all of their stuff right there across your patients and community. You're not going to find this from the big alliance buying groups and these other entities that are interfering with so many aspects of the patient. It's about an independent practice. Dr. Reghetti, I think you found some of those testimonials. Please share a couple of those, because I know I've read a few of them here over the last recently with some high profile clients, and it's really powerful. Why don't you share some of these results that they're getting?
Yeah, sure. It's going to be awkward for me because I don't like to toot my own horn, but I will read, read what's on here. So I had the opportunity to work with Dr. Janelle Davison. So she is a huge in dry eye, just opened a beautiful clinic in Georgia. So she said, working with Caitlin from Dr. Reghetti Designs was a breath of fresh air. Collaborating with a fellow OD like her was a delight as she brought my vision to life effortlessly. Caitlin transformed my rough ideas into beautifully designed patient brochures and referral pads that are both visually appealing and user friendly. I wholeheartedly recommend her services. So for her, we made a customized brochure that has actual images of all of the products that she recommends. So patients can take that and have, a true picture of what they're looking for. And it's not just a Word document of different pictures and a list of products. It looks really nice put together. Dr. Brandon Wally, he's big into vision therapy. And he said, I love the custom brochure made for my vision therapy practice. I had a specific idea in mind and Caitlin took that and created exactly what I was looking for. So again, just another custom brochure that came through focusing on vision therapy. So I've had a couple vision therapy ones come through. Those are always the most fun for me because I don't do vision therapy myself. So I always learn something new every time I do one of those.
Love it. Love it. And I think it's also powerful to note in both of those doctors that have created amazing practices. And even when you think, can my practice get to the next level? It absolutely can. And when you look at tools like this, right? Healthcare literacy, differentiation of the practice, tying that patient, closing that feedback loop. And I really love the way you refer to that, Caitlin, right? Closing that feedback loop, that omnichannel experience with the patient. Just huge, huge, huge. And it's huge for two reasons, right? Number one, first and foremost, when we think about the impact this has on patients and clinical outcomes, I mean, let's face it, Caitlin, you shared earlier in our conversation, right? Once again, folks are only hearing 40 to 80% of what's being spoken, and they're only retaining about half of that. So, number one, before we even talk about the impact this can have on the bottom line of the practice, which, by the way, spoiler alert, it absolutely has an impact on the bottom line. But outside of that, I think it's imperative to consider, y'all, I mean, this is huge. We have this ever growing public health need for vision, medical, and specialty eye care. So, if we've got resources to be able to enhance compliance and therefore enhance healthy outcomes, it's a no brainer. And then, number two, closing that feedback loop, bolstering that patient provider relationship in a way that nothing can detract from that is huge in building profitable businesses that are going to serve patients and communities. Dr. Reghetti, this has been an outstanding time here at the Cold Start Corner. Before we hop off, why don't you please share with our viewers how can they get in touch with you?
So I have a website that is drreghettidesigns.com. So you'll see it down there. It is DR, so it's not a full doctor, it's the abbreviation. So Dr. Reghetti Designs, and you can use that same name for LinkedIn, Instagram, Facebook, and Etsy. So whatever your mode of contact that you prefer, you can reach me through any of those, or you can email me at contact@drreghettidesigns.com. So I'm always open to any type of input, questions, anything that you may need.
Dr. Caitlin Reghetti, amazing work that you're doing with Dr. Reghetti Designs, and also amazing work. And as you know, grateful for your collaboration here with Team Akrinos as our clinical liaison. So it's an amazing time to be in practice ownership, y'all. And for everyone that's tuned into this episode of the Cold Start Corner, you're probably still on that front end of your journey, right? For some of y'all may be in the process. For others, maybe the time's not right just yet. Well, I'm here to share with you. It is absolutely an amazing time to get into practice ownership. As you're growing and scaling your business, check out all the remarkable ways that Dr. Reghetti Designs can serve you. And no matter where you are in this journey, Akrinos got you covered, right? We're all about making the business of eye care approachable, accessible, and profitable. Whether you're starting, growing and scaling, or looking to exit your practice, head on over to Akrinos.com. See all the amazing ways that Akrinos' business foundations will set you up for a thriving practice. Dr. Reghetti, before we wrap up, any closing remarks for our viewers out there?
I don't think so. I think we kind of touched on everything. So, like I said, I'm always here for any new ideas. I'm trying to branch into maybe some more like digital stuff for websites, educational videos, stuff like that. So, if anyone has any ideas, just let me know.
That's it. So y'all head on over to Dr. Reghetti Designs and head on over to Akrinos.com and let's make it happen. No matter where you are in your journey, also, good luck. Have an amazing week. Take care.
Bye.